So the title of the presentation is Understanding the Screening, Identification, Assessment and Support Process within a Multidisciplinary Practice. So CIAS is an acronym, and some of you knew what the different letters meant. So it's there we have it: Screening, Identification, Assessment and Support. And within a multidisciplinary practice, because although teachers do it, it involves a range of role players that I will talk about in a moment. Okay, so we're going to talk about the transformational aspects of the CIAS policy. You've heard that there's quite a mind shift that is needed to think inclusively, and the CIAS helps us to make that mind shift. How the CIAS policy supports the social and rights-based model of disability, understanding low, moderate, and high needs for support. So sometimes we say someone needs support, but what level of support do they need? I'll give you an overview of the CIAS process, and then we'll apply the CIAS from the perspective of some case studies, and then understanding the roles and responsibilities of stakeholders in this process, and then talking about parents and community. Okay, and so I think you, from the preceding discussion, I think you're all very familiar about what inclusive education is. It's a fundamental human right. It's a principle that values all students equally. Every learner matters. So often in our country, I'm not sure it is the same in other countries, you get the feeling that it's only the learners who can perform well academically that matter. But every learner should matter. Every learner. The child matters to the parent, and the learner must matter to the teacher equally. It's a means of realizing other rights, and it is the result of a process of commitment to eliminating barriers to the right to education. This is just a slide on the key features of inclusive education. The system, it's a whole system approach. It's not just about what happens in the classroom. And you'll see as we go through the CIAS, it's a whole educational environment. It's about the whole person. Environments that are required, supported teachers, respect for diversity, learning-friendly environments, needs to be sustainable. There need to be effective transitions. We need to build partnerships. There needs to be ongoing monitoring. Okay, understanding the transformational aspects of the CIAS policy. What is the purpose? Why did we do that? So for many years, children were being referred for support or referred to special schools in various ways. There was no standardized procedure in our country. And so you'd find the situation in some of our special schools that there were many learners there who really didn't need to be in special schools. They didn't need that high level of support, and vice versa. There were children in our mainstream or our ordinary schools who needed support, who weren't getting it. And teachers didn't have a way of referring. It would be very ad hoc. They would phone the local school clinic or the local hospital, and it was luck of the draw sometimes who got to get support. So we needed to standardize the procedures. Also, every province had their own set of forms. So when a learner moved from one province to another, you wouldn't always get the information that you required. The purpose is also to improve access to quality education, to manage and support the teaching and learning processes, to also establish a seamless system of early identification where we work, for example, with the Department of Health and the Department of Social Development to early identify these children who need extra support. It directs the system on how to plan, budget, and program support at all levels. And it is a key procedure to ensure the transformation of the education system towards an inclusive education system in line with Education White Paper 6 and the Convention on the Rights of Persons with Disability. So, like some of you pointed out earlier, this is not just about including children with disabilities. It is about transforming the whole education system so that each child will be valued equally. Every child will matter. Okay, and then the first point that is emphasized, it acknowledges that every child has the right to receive a basic quality, basic education within his or her local community whenever possible. Now, sadly, in our country, and I'm not sure in the countries that some of you come from, not every child is getting a quality basic education. Many of them are not even in school, so it is a challenge. Now, the principle to ensure that support or reasonable accommodation will be available to more learners in mainstream settings, reducing the need for referring them for alternative placement. So we've in the past had the situation where teachers would very easily try and refer to a special school without really doing too much in the classroom. And we're trying to shift that as well. So have you done all you could? Have you consulted with whoever you have available to see how this child can be accommodated in the classroom in his or her local school? Another principle involving parents and teachers in decision-making about the support to be provided and viewing a child within his or her own context. It results in more cost-effective and efficient use of scarce professional human resources. And the idea is that we ensure that admission to special schools would be restricted to learners who have high-level support needs. So just a little story from our own province. For many years, we've had these long waiting lists for children to attend certain kinds of special schools. We don't have waiting lists for children to attend schools for the deaf or schools for the blind, but we do have long waiting lists for children to attend schools for specific learning disability, sometimes also known as dyslexia. So those of you familiar with the Western Cape, schools like Tafelberg Remedial School or Jan Kriel School. And it wasn't getting any better. Every year there were more and more learners being referred until we decided, let's have a meeting and just discuss this. And we asked the schools, are all the learners in your school really high needs? And they said, no, some of them could cope in an ordinary school if they got some support, if they got extra time to write the examinations, if they had somebody read to them. So we said, well, before you admit a child to your school, we'd like you to visit the school, the mainstream school from which the child has been referred. And so we started a system of outreach teams from these schools, and they would visit the school as a team, and on the team would normally be a therapist, a remedial or learning support teacher, and a psychologist. And they would do classroom observations, or they would sit with the team at the school and discuss the learner. And you know, after we'd done that, after a few months of doing that, parents would phone us and say, it's okay, I don't need my child to go to a special school anymore because he or she is getting the support in the school where he or she is. But they were also, when they visited the schools, they also found there were some learners who really weren't coping, teachers who really weren't coping. These were learners with very high support needs. Many of them were children with autism, but not only. And so we're getting to a stage now where it's most of the time we're quite good now at identifying who has high support needs and who has low or moderate that can be catered for in a mainstream school with a little bit of extra support. So the CS helps us do that, to come back to the presentation slide, to ensure that admission to special schools is restricted to learners who have high-level support needs. We have to align our screening and assessment processes to those in health and social development. Another exciting development at the moment, we're working with a doctor from Red Cross Hospital, because they would often refer to us and wouldn't know whether the child got placed. So we are working now on a kind of a Google form that they can refer to us, and we can track who's referred to us, and we also will then have access to prior medical or health records. And we've also just drawn social development in so that we can also get the picture from social development if the child has been seen. Okay, support is centrally curriculum support, and we provide support along a continuum of intensity ranging from low to moderate to high. So I've mentioned that, and just to say that most of the time low support in our primary schools is from an itinerant learning support teacher or remedial teacher who withdraws a group of learners and works with them, works alongside the class teacher, co-teachers. Moderate support is mostly in our what we call full service or inclusive schools. We give them a full-time learning support remedial teacher. We give them an inclusion or a facilitator or a classroom assistant. And we also have outreach teams from our special schools visiting those learners. So that is just in practical terms how we've arranged for low, moderate to high. Then the support package for a learner could consist of a range of support provisions that that may be customized to the level of an intensity of support. Again, there's the vision of Article 24, which all of you have read about. The right to education without discrimination, inclusive education system at all levels. That includes universities or tertiary level, reasonable accommodation, individual support measures, opportunities to acquire skills, to participate equally, and access to teachers qualified with appropriate skills. Now, that is also a problem. In our country, until maybe 20 years ago, there were courses at university for teachers to specialize in disability studies or in visual impairment, hearing impairment, listening and language, and so on. But with the budget cuts at universities, a lot of those courses were phased out. In fact, we are so happy now that there's the TEDI courses, which again allows people who want some additional information to do an accredited course. But even just knowing in general how to deal with children who learn differently, many of our teachers struggle with that. But that also, there's light at the end of the tunnel. The British Council, in collaboration with our universities and some NGOs, has developed a course for pre-service teachers. So all pre-service teachers from, I think, next year will do a module on teaching inclusively. And then we, in this province, we've piloted that model for in-service teachers, because all of our 30,000 teachers in the province, when you ask teachers, it's about probably 1% of them who've ever been exposed to a course that gives them skills to teach inclusively. So soon there will be an online course for all our teachers in the province, a free course that would be enabling them to develop the competencies to teach more inclusively. Okay, and that's just the importance of Sustainable Goal 4 and the Education 2030 and the Incheon Declaration. Okay, so what's the difference between special, integrated, and inclusive education? So inclusive education is about changing the holes. It's a system to fit the pegs. So when you've got a range of children in your school, you have to adapt according to the needs of the children. Special education in its traditional understanding is round pegs, non-disabled children in round holes, mainstream schools, and square pegs, disabled children in square holes, special schools. Now, that's not how we see it. We see special schools these days as providing a high level of support, and the child should only be there for as long as they need that high level support. So there should be fluidity. They should be able to move from a special school maybe to a full service school, and maybe even to an ordinary school. But the traditional idea was once you're at the special school, you're at the special school forever. And that might not be necessary for all children. Then an integrated education is changing the pegs to fit the holes, getting the kids to do things differently so that they can fit in. And I think language and all the issues around language is perhaps a good example of that, where the children have to speak the language of the school and forget about their mother tongue. I get some nice diagrams here. Equality, we say we're going to give equal funding, equal education, but that is unfair. Equity, you are leveling the playing fields and everybody can watch that game. But why not just take away the fence? Okay, and that is inclusion. Take away the barriers. Okay, I'm going to skip that. So let's just talk again about level and nature of support. So not all learners who are diagnosed with a disability have the same level of support needs. Just because you've got a medical diagnosis of a disability doesn't mean that you have a high level of support need. And support needs not be site restricted. It doesn't have to only happen at a special school. We say the support can go to the learner. That's a big push of ours at the moment. Taking the support to the learner rather than the learner to the support. So it can be based at a school or a nodal site, a circuit or a district. Provincial factors play a role to determine where and how best to deliver the services. Support needs to address the barriers arising from factors such as disability, psychosocial and contextual conditions, and CIAS aims to identify the barriers to learning, the support that you need, and in the support program that needs to be in place to reduce the impact of the barrier. So in what areas are we going to deliver the support programs? In curriculum and assessment. So in curriculum, perhaps it's very simple things sometimes because it doesn't have to be complicated, like reducing the number of tasks that the learner needs to do. Assessment adjustments, and I've mentioned one or two of them already, like extra time or having someone read to the learner. And I mean, technology is so advanced now that you don't have to have a human being read to a learner who struggles to read. We've got something called the reader pen. As you move this pen across the text, it reads to the learner. The learner's got earphones. It doesn't disturb anybody. So that is, in the long run, much cheaper than having readers. Training requirements. Sometimes you will go into a school and you realize this problem is not because of the learners. It's the teachers that need the upskilling and the training. availability of specialized staff. So we're quite lucky in the province. We have many therapists, occupational speech, physiotherapists, audiologists, but in the public system, in the state system, there's not enough for individual support. So we do a lot of capacity building of teachers, parents, by the specialized staff. Then another area in which you can deliver a support program is specialized LTSM. For example, for a learner who has a visual impairment, you could enlarge the print. The various, we have in this province at the schools for the blind, we have given the learners from grade 4 to grade 12 an e-braille reader, which is like a little laptop. And so you can just plug in the information on a flash drive and it's available in braille. So that's really been very useful. Assistive devices and other resources to ensure access to education. We've got a project running in the province to provide very simple ramps for those with a physical disability, where accessibility of the physical environment is important, and it's actually not expensive to do, and we've done a lot of small projects like that. One of them is at a school in one of our really poor areas in Ravensmead, and so we put the learner was shot in a gang-related shooting, but still wanted to attend her local school. So we arranged for ramps to be put in the school. And then the city of Cape Town, the municipality, came to the party and tarred the pavement. It was a sandy pavement outside. Tarred the pavement all the way to her house. And so not only was she able to attend school, but it also made walking to school easier for her classmates and schoolmates. So, yeah. Okay, let me move on. So this is how we've conceptualized it in the province, and it's based on CIAS. So we say it's often a teacher, a parent, or a health practitioner that identifies that the learner has a barrier to learning. What are we expecting after that? We expect the classroom teacher to do intervention. We expect him or her to fill in the support needs assessment form 1, which we're going to do together in a moment. After a while, the teacher might find that the learner is not really benefiting or not progressing as desired. So then the teacher can ask for a school-based support team meeting. So I realize that not all of you are from South Africa, so you might not all be using these documents that I'm going to mention, but I think let's just see what the principle is. So it's important for the teacher to document what he or she does in the classroom and what he or she knows about the child. So that is your SNA1, which we'll look at in a moment. We expect all of our schools to have a team that meets regularly. We would like these teams to meet every week if possible, just to discuss the children that are not coping that well in the classroom. That's a school-based support team. When they discuss the learner, they might decide, but actually there's a lot more that the teacher can do. So that's our first bubble there. Additional class teacher intervention. But perhaps everything's already been tried in the class, so we might want to refer for extra learning support, or perhaps refer to the Department of Health, for example, a school nurse. Perhaps the learner has visual problems or hearing problems, so we'd like that tested. Once they've done that and there's still not been an improvement, then the school can refer to the district-based support team, and that's where all our specialists are, our social workers, our psychologists, our learning support advisors, and there you'll see it's SNA 3 form. And once they have a look at all the documentation that comes through, they will decide whether this is low support or whether it's moderate support that the learner needs or whether it's high level support. And so if it is low level support, they will then give advice to the classroom teacher. If it's moderate level, like I mentioned earlier, it might be that we would provide that at a full service school or an inclusive school, or we will have a team going out from the special school to advise the school. If it is high level support, then we would consider a special school placement. And so now that we've got this process in place, we're not finding so much that low level and moderate level support needs learners are going into the special school. And it's really streamlining, and everybody understands the support pathway now. Sometimes the district-based support teams refer to us, so that is, we call ourselves a provincial-based support team. So say, for example, there are many children at grade 4 level who are not learning to read or haven't mastered reading at the level expected in grade 4. That is not an individual learner problem. That is probably a system problem. So then my job would be to speak about this when I go to national meetings and say perhaps there are too many tasks in grade 4, or perhaps we are rushing through this CAPS curriculum which we have, and we're not making sure that the learners are mastering the basics of literacy and numeracy. So that is a higher level intervention, a system intervention that needs to take place. Also, I forgot to mention, sometimes you also find that at classroom level, there are few learners that are referred for a similar problem. So you're not going to do an individual support plan for each and every one of them. And there we've coined the term a group support plan. So it's not in the CS, but we think that's useful to group learners who have similar problems. Okay, so when we do this properly, what we expect is that 80% of the learners can be helped at classroom level by the teacher. Perhaps 15% of the learners need some additional support, and they can usually be helped by the learning support teacher, or be given advice from the district-based support team or the special school outreach teams. And then it's really only 5% who need that high-level support. Okay, so the first step to follow in the CS protocol is screening. There's a learner profile, a health and disability form. You also have to look at the Road to Health card, which is the health department's document, which is goes with the child from birth, and all the health information is recorded on that. Health and disability assessment form, and you I believe you've been sent all these documents. And then, as I've mentioned, sometimes it's not entirely possible that the education department can fulfill all the support needs. And I love this picture. It's the Care and Support for Teaching and Learning poster. A learner-centered, multi-sectoral approach to care and supports. And there's the learner in the middle, there's the teacher, there's the school support team, the school management. But sometimes we need to bring in the extended family, the foster parents, other caregivers, obviously the parents. But perhaps it's more than that. We have to go wider. Perhaps we need to bring in social development, or home affairs, or health, or transport, etc. Or even NGOs or community-based organization. But it all starts in the school. So it is a learner-centered approach. The education department is the lead agency in addressing school-level barriers, and the education department tries to create an enabling environment for other stakeholders. Okay, we've got an integrated school health program, and I think that is national, where we promote schools as center of care and supports and the various health services that are in the package. Okay, so the first, when the learner enters the school, usually grade R or grade 1, we expect that the learner profile is filled in for each and every learner. When the teacher or the parent informs the teacher that the learner is experiencing a barrier to learning, we expect SNA 1 or Support Needs Assessment 1 form to be filled in. Okay, so I want to just show you SNA 1 now, because I think it is one of the most important tools. Oops, sorry. Let me just close this. Okay, Support Needs Assessment 1. Okay, I've spoken quite a lot, so I'd just like to check if there are any questions about what I've shared with you so far, and then we're going to do a little exercise.
Berenice, I think Linneo had a question.
Okay, Linneo. Please go ahead.
She had her hand raised earlier, so I'm not sure if she still would like to pose that question. Linneo, did you want to ask something? Okay, she's not there. Maybe we just move on, Berenice.
All right. Okay, so I'm going to just share with you the CS.
Hello.
Hi. Yeah, Linneo. You wanted to ask the question?
Yes, I wanted.
Yeah,
yes, I wanted to check. When you were speaking, when you were talking, it's more like CS is applicable to, stand to be corrected, to children that are already in the school. What about the children that come from home applying for the school? Can CS be implemented on them for admission? Or it's only implemented for learners that are already in the school?
Okay, that's a good question. So it's mostly implemented on children who are already in the school. But like I mentioned earlier, we are having discussions with the Department of Health so that we get, when they refer, they use our forms, so we get the information that would be useful for us to plan a support program for a learner. So DBE, I think it is 126, is the one that can be filled in by the Department of Health or any other health practitioner to refer to us. So it can start with that. Also, what we do is for out of school children, I'm thinking of children with autism spectrum disorder, we have outreach teams. They do assessments of these children, and so they use the forms. They have them there for a week-long or 2-week-long observation and try and fill in the applicable forms. So yes, you're right, mostly with children in schools and in preschools, but yes, it can also be used. It's a whole package of different forms that can be used by others as well. Okay, Sipa Mandla, you have a question?
Yes. Okay. In your presentation, you talked about what do you call this? You talked about CS looking at not including the one size fits all process in terms of dealing with an individual. Okay. However, I heard you talking about group support and saying learners with similar challenges, you would group them together. And in the beginning, you talked about though learners might have similar challenges, they need individualized, what do we call this, intervention. So how does that go about?
Okay, so say for example, in a particular class where a lot of children are struggling with maths, right? And they all, maybe all of them didn't go to grade R. I'm just going to use an example like that. And there are about 5 of them. The rest of the class all went to grade R at the school. So now each one of them is referred to the school-based support team. But actually, they all have a similar challenge. They've missed out on the basics. So you might write a group support plan for those 5 learners. Because you're not going to write an individual support plan for each one of them. So when you have learners who all have a similar problem, you could write a group support plan for them. It really does depend on what you identify as the support need. Yes. I'm just trying to open the CS while we're talking, so just excuse me. I'm just please go ahead, whoever else wants to ask a question. Okay, I might need some technical support here. Chantal or Judy, just to open up SNA1. I'm not sure why it's not opening. Let me try again.
Okay, I'll try from my end as well.
Are you opening the actual form, Berenice?
Yes, yes, the blank form.
So I'll also see if I can get to it.
Oh, I think I'm getting some that one. Oh, there it is. No, okay. All right, so what I asked you to do for homework was to write a story about a child that you know or you've worked with, and just write the story. So can I see by show of hands, did you all do your homework? Aha, we do have some CC per Mandley's hand. Anyone else who's done the exercise? Oh gosh, I'll have to send some of you to detention. Okay, all right. If not everyone has done it, Sipho Mandle, can you tell us your story? Really, maybe you can just read the first few paragraphs, just to get an idea of who your child is that you chose to write a story about. Please go ahead. Are you there? Anyone else? Don't see. I think you might be struggling. Okay. Okay. If we don't have,
I wonder, Linnea has actually sent her story to us.
Yes, that's right.
It's in a written document, and she might not be able to talk it through, but we've got it. I don't know if that would help.
Okay, all right. So Linnea, be on standby because I'm going to go through the form now, and I might just ask you to indicate where what you've written fits in. Okay, all right. So this is what SNA1 looks like, the support needs assessment form. Name and surname of the learner, name of the school. Okay, so the teacher starts by indicating her or his area of concern. Describe your concern about the learner. When did you become aware of this? How did you become aware of this? Was it your own observation or was it reported to you? How is this observation affecting the learner's learning and development? So you can see it's free text there. You just write the story, why you are concerned about the learner. Next, it asks you to complete the following table with regard to the learner's scholastic profile, the year, the grade, the result, the number of schools attended. It asks, has the disability been diagnosed by a health professional? So that comes back to Linnea's question, and then you'll see there is a form that could have been completed. If yes, complete the following and attach the reports, the healthcare professional, the date of assessment, the summary of results. Now we move on to the second session, and I really want you to note what it says. It's not only about the concerns, it is also about the strengths of the learner. So often teachers would refer and say, this child can't do anything, he's hopeless, you know, that kind of language. We try and discourage that. We encourage teachers to have a growth mindset. We encourage them to also think about what the learner's strengths are. So let's look at the different categories. The first category there is communication. What are the learner's strengths in communication? So I don't know, Linnea, your learner that you offered as a case study, what does the learner have any strength in communication?
Berenice, if she's not able to, then there's Priscilla and Reva who also did their case study. So perhaps they'd like to step in.
Okay, well. one of you, would you like to share with us your learner's strength in communication? Any one of you?
For instance, in the case of the learner from me, she's a girl, and she's able to. She's a deaf girl, so she's able to communicate in sign language.
Right. Okay, here we go. So you'd say, you know, if somebody is deaf, maybe the tendency would be only to see that as a problem. But as you say, a strength is that she is able to communicate in sign language. Okay, but what are her needs in terms of communication? Let's just go with your learner for this one. Reva? What are her needs in terms of communication?
So as she's a girl, she has a difficulty to speak. So I think that she needs support for that.
Okay, so in that. So perhaps the need would be to communicate more effectively in sign language, and then you would indicate what the support as a teacher, you know, what you could do in terms of support. So I'm going to continue with your learner. In terms of learning, does the learner have any strength in terms of learning?
Yeah, Berenice, I have a question about the above one. About the support needed in case of spoken difficulty. In this support needed, should we think about material support or pedagogical support, or what kind of support should we write down there?
So it's support that is needed in order for her to communicate. You might say here that no, she communicates quite well in an environment, you know, where everyone is able to understand sign language. but you might want to put in there that support is needed at home because the parents don't know sign language. But
Can you write, for instance, hearing aids?
Excuse me,
Can we write there hearing aids as a support, for example? Hearing
you
aids?
can. Yeah, you could. Yeah. Okay. So I'm just going to say that this is how this form gets filled in. You see, so you think about what are the strengths, what are the needs, what are the possible support needs. I'm just going to go through and maybe I'll ask you again about your learners. So learning, again, are these strengths? You might say this is a very, this learner is above average in terms of learning ability, no support needed. Then we get to behavior and social competence. And you'll again say this learner is extremely disciplined learner. You know, there's no needs here, no support. You get to this section on classroom and school. What factors within the classroom and school impacts on the learner? Perhaps the strength would be that we have a you know, you can talk about the classroom environment, and you might say that it's actually a strength. It's a customized environment, so there are no needs here, no support needed. Then we look at family, home, and community. Maybe strengths, very loving family, parents very involved, etc. Then we look at teacher interventions and supports. Curriculum, what curriculum interventions have you as a teacher implemented, and what have been the successes, but what have been the challenges? Then comment on teaching methods. Have you changed the teaching method that you're using anyway, and what has been successful and what has been a challenge? Now, if teachers fill this in a way that gives somebody that this form is referred to a good idea of what's already been tried. Say it is referred to the district, then you're not going to try the same thing that has already been tried. You're going to try something different. Then we go on to assessment. Has the assessment been modified, like I explained, fewer test items, or having a scribe or a reader? What interventions have you as a teacher implemented in the learning environment? So, for example, if it's a child who doesn't socialize well, have you perhaps arranged a buddy system? Comment on how the physical environment has been modified, adapted. If it is a child with a physical disability, you might say the success there is that a wooden ramp was placed at the entrance to the classroom. But a challenge maybe is that the learner is unable to access the school hall or the whatever. Just making some silly examples, but I hope you get the sense, you know, that we're going to look at everything pertaining to the learner. And then any additional comments that you want to make. What additional support do you as a teacher require from the school-based support team? What have you done so far? So there's a log of consultations with the parent or the guardian or the learner, him or herself, the views expressed by the parent, the caregiver, the learner. And you know, that is SNA 1. So what I'd like you to do, and I think that has been communicated with you, is to take your learner story and try and fill in whatever you can on the SNA 1 form. And yeah, if we had done it, it would have been nice, because you'll soon realize that, oh, I never even thought about that. You know, so the aspects pertaining to a child, that if you don't go through the SNA 1 systematically like this, you might miss things that are strengths that could be used to provide support. Okay, so that's just a quick run through of the SNA1 form. Okay, I'm just going to share screen. Just give me a moment. Okay, oops. Okay. Okay, are you seeing my I've gone back to the PowerPoint.
Yes,
Okay,
that comes through.
okay, all right. So let's just recap. So the support pathway would start with a teacher or someone identifying the learner as having a barrier. There should have been some classroom intervention which the teacher will document on the SNA1. There could be a school-based support team meeting, and there might be some additional interventions. But if that is not enough, it could be referred to the district-based support team. They will have the SNA documents, and that will enable them to see what has already been done, whether they need to do additional assessments, and then to determine what kind and level of support. And at all times, we've got to remember to involve the parent and the learner. Okay, but I don't have a lot of time left, so I'm going to move a bit more quickly through. So those are all the forms that make up the CS toolkit. The annexures, there you see Annexure D is the health and disability assessment form. Okay, and this is just a recap of some of the things that we had spoken about. Okay, so we've spoken about the school-based support team. These are the members that we would like to be on a school-based support team. The teacher who is referring the problem, other volunteer teachers, a member of the management team of the school, teachers with specialized skills, but there could also be some non-core members. We've spoken about the learner at risk. The teacher completes the SNA1 form. On the basis of the information gathered, an individual support plan is formulated, and that's also in the CS documentation, which once you've completed your SNA1, it will give you ideas of what should be in an individual support plan. And that is just at the teacher level. As you have seen, when the teacher's not able to address the challenge fully, they would call in the district-based support team. Okay, that's what the SPST does. And when it goes to the district, we will use the Support Needs Assessment 3 documents. Okay, so we want to have family involvement. So all along, you saw the bubble popping up about parent involvement, and if the learner is old enough or is able to participate, involve the learner as well. When I showed you the care and support for teaching and learning model, you saw that we also sometimes need to go into the community. There are community-based services, community-based rehabilitation, local networks, support groups. Okay, so one wants to encourage a move away from over-reliance on external professional support. We'd like schools to embrace inclusion and the rights of all learners in terms of ethos, culture, and practices. We encourage team problem solving, like you've seen there with the school-based support team, involving parents and community, and an integrated service delivery by health, social development, and education. So in this country, we've got what is called the Integrated School Health Program, and the main role players there are education, health, and social development. And in this province anyway, we meet regularly at district level with our counterparts in the other departments, and we put together a pathway so that we can refer across our boundaries. Okay, I'm going to stop the presentation there because I do want to leave some time for us to have a discussion about what you've heard. It was really a rapid run through, but let's hear what your thoughts are about the screening, identification, assessment, and support policy. Okay, anybody? Okay, all right. So nobody's volunteering, so I'm going to ask each of you your thoughts now that you've seen what it is about. It is a tool that has been developed in our country, but I think that the general principles could apply anywhere, and I'm sure other countries also have similar tools, but I'd be keen to hear your views.